parents to feel comfortable about that it shouldn't be considered something so out of the ordinary. It should be part of your overall well-being, whether it be a physical ailment or a mental issue, that it should all be a composite when the physicians, whether you're younger or, and you pointed out very well that we need to not forget about our elderly population and having the offices with the social worker close by. I think all of that works very well together. With the younger generation, with the school, we just have to keep the conversation going that and invite people to recognize the problem, because I think, Jennifer, your group says the prevention, if we're talking about costs, early intervention, education, prevention, we save a lot of cost in the end, and everybody has a better quality of health in the long term. So I think it's going to be an ongoing effort by all of us in the room, the parents, the schools, the dean, all of us, the professionals, the healthcare providers, the legislators, trying to get it right with the bills that go forward. And I would be remiss if I didn't mention that we have Damian Fontanella here with us tonight from the Healthcare Advocate Office. So people that are having trouble accessing healthcare, your office would help them. So we're all in this together, and we need to continue to work together. I know you mentioned my family, not to say, but years ago my dad introduced, Jennifer knows, the iris as the symbol for mental illness awareness, because I've seen an evolution over the years when way back decades ago, no one knew where to go. No one knew where to turn. If you had an issue, no one knew how to speak about it. It was really almost a helpless situation. So I think we've really, as you had pointed out, Jim, we've made a lot of grounds, but we need to continue the work. So I hope we can continue these conversations on a fairly ongoing basis and try to continue to identify where the gaps are and how we can continue. One thing for me that's very difficult, you mentioned, so I'm a novice at this, I admit right away that I'm trying to learn. I think what I've heard a lot is that our Medicaid reimbursement rates are very difficult, and that we're hearing that on the outpatient services particularly, there are a lot more demands and needs, but with a lot less resources. So with the exacerbation with transportation, people not getting, and then you have a backup, and then you can't provide the service, and then you're not getting the right reimbursement rate. I don't know how you handle that. That's a big one. We do have a working group up at the Capitol looking at Medicaid reimbursement rates and how that has changed. But with the new healthcare system, I think there are more and more people on using Medicaid, and then the reimbursement back to the providers is less, so then you have people that can't get the treatment, and so we need to figure it all out. But I think we're making steps in the right direction, and that gives us hope, and that's important. So if we can, is there anyone else that would like to add to some of the barriers you see or some of the gaps you see within your own organization? You've touched on some of the areas that we can help improve. I did want to point out there is another bill that will be looking, you probably know more about it than I do, but that looks at parity in the way, how we treat people that come in, and that they will not be denied services because it's a mental health issue. We need to work in that area quite a bit as well. So I just want to point out that those are topics that are in discussion in the legislature. I think we have a number of people here, and I want to give them an opportunity to interact with the experts that we have here tonight